This is a short tutorial on how to use a glide scope with a hyperangulated blade and rigid stylet. You want to first place the blade midline without sweeping the tongue and rock slightly backwards so you get a good visualization of glottic opening. You want to then place the endotracheal tube with the rigid stylet right at the glottic opening. Once you're at the opening, you want to disengage the rigid stylet with your thumb, advance the flexible tip now a little bit further, disengage some more, advance the tube some more, and then remove the stylet completely. You want to leave the hyperangulated blade in the mouth so you can visualize the cuff being inflated, making sure that it is not at the level of the cords. When using the glide scope with a hyperangulated blade, there are two common mistakes that you should try to avoid. The first one is having the blade too deep. You want to be able to see the cords and the glottic opening from a bird's eye view. If you're up too close and too personal, what's going to happen is you're going to find that the endotracheal tube will continuously hit inferior to the glottic opening, and you're going to find it very difficult to pass the endotracheal tube due to the steep angle of attack. The solution is to pull your blade back slightly to get a better overall view of the cords and the glottic opening, and that will facilitate better passage of your endotracheal tube. The second biggest mistake is forgetting to disengage the rigid stylet from the endotracheal tube. Remember, the hyperangulated blade and the rigid stylet are designed to go around all the soft tissue, including the tongue. The curvature of the rigid stylet will make it difficult to pass the endotracheal tube unless you disengage it and allow the tip of the endotracheal tube to slide into proper position. Without doing so, will make it extremely difficult to pass the endotracheal tube and can cause severe trauma. And lastly, one of the limitations to using a hyperangulated blade is that you cannot do direct laryngoscopy with it. Therefore, if you soil the fiber optic camera with blood, emesis, or secretions, you're going to render the VL pretty much useless because you're not going to be able to see what you are doing. So in summary, place the blade midline and get a very broad view of the glottic opening and the cords without being too close, or you're going to find it very difficult to pass the endotracheal tube. Once your tube is right near the cords, you want to disengage the rigid stylet. This will allow the tip of the endotracheal tube to become more flexible and glide into the proper position. I hope this video has helped with your use of the glide scope with hyperangulated blade. Good luck with your future intubations.